I was glad when they said unto me, let us go into the house of the Lord. Where my praise is at tonight, come on. For we are the generation that God has created, that we may show forth his praise. Come on, this is a simple song that we do in the house. Come on, everybody lift your voice and say, come on.
Come on, everybody.
And let's lift his name.
Let's lift his name.
Sing praises to our Lord and King. And let your praises ring. Come on.
Come on, everybody.
And let's lift his name.
Let's lift his name.
Come on, sing praises.
Sing praises to our Lord.
Come on, Thomas King. Come on.
Ooh, come on, yeah,
Come on,
yeah.
everybody.
Lift his name.
Let's lift his name.
Sing praises, yeah.
To our Lord and King, let praises ring.
Come
on, everybody.
lift his name.
Lift his name.
Sing praises, yeah.
To our Lord and King, let
You
praises
are my God, yes you are.
my God.
You are my Lord. You are my King.
My King.
My everything.
Come on, everybody.
Lift his name.
Lift his name.
Sing praises, yeah.
To our Lord and King, let praises
Ooh,
ring.
come
Come on, everybody.
on. Lift his name.
Lift his name.
Sing praises, yeah.
To our Lord and King, let
You
praises
are my God, yes you are.
my God.
You are my Lord. You are my King.
My King.
My everything. Come on,
Everybody.
lift his name. Sing praises, yeah.
To our Lord and King, let praises ring.
Come on,
Everybody.
lift his name.
Lift his name.
Sing praises, yeah.
To our Lord and King, let
You
praises
are my God, yes you are.
Good afternoon. Thank you for being with us on today. Dr. Maurice Willis is our guest, and we are talking about men's health, the Lafia Wellness Ministry of First Baptist Church, North Indianapolis, under the direction of Marcella Armstrong, along with our brotherhood under the direction of Chief George Armstrong. They've pulled together at the tail end
Come on, everybody, put your hands together tonight. For I was glad when they said unto me, let us go into the house of the Lord. Where my praise is at tonight, come on. For we are the generation that God has created, that we may show forth his praise. Come on, this is a simple song that we do in the house. Come on, everybody lift your voice and say, come on.
Come on, everybody.
And let's lift his name.
Let's lift his name.
Sing praises to our Lord
Praises to our
and
Lord
King. And let your praises ring. Come on.
Come on, everybody.
And let's lift his name.
Let's lift his name.
Come on, sing praises.
Sing praises to our Lord.
Come on, Thomas King. Come on.
Ooh, come on, yeah,
Come on,
yeah.
everybody.
Lift his name.
Lift his name.
Sing praises, yeah.
To our Lord and King, let praises ring.
Come
on, everybody.
lift his name.
Lift his name.
Sing praises, yeah.
To our Lord and King, let
You
praises
are my God, yes you are.
my God.
You are my Lord. You
today. Dr. Maurice Willis is our guest, and we are talking about men's health, the Lafia Wellness Ministry of First Baptist Church, North Indianapolis, under the direction of Marcella Armstrong, along with our brotherhood under the direction of Chief George Armstrong. They've pulled together at the tail end of June our men's health forum that we normally do. Today, we are virtual, and we are here with my good friend and my classmate from Morehouse College. I did not have his name on here, but he is Maurice Willis. Maurice Willis is professor of general oncology at MD Anderson in Galveston, Texas, and many of us remember him from a segment we did earlier. Maurice Willis is a strong member of the Morehouse class of 1991, and it continues to be my distinct privilege to serve as the president of the class of 1991. And it has been our concern as a class to ensure, just as we did maybe about 6 months ago with COVID-19, we want to ensure that we educate and let people know everything they need to know to have healthy outcomes and to live healthy lives, to improve their health and to improve the ability they have to live effective and efficient lives, to live abundantly here. And so we thank Dr. Maurice Willis for being with us on today. And I'm just going to ask a few questions. When we deal specifically with men's health, we deal with some particular conditions, some specific pathologies that are unique to men, and some that are unique to African American men. What should we watch out for, and how should we educate ourselves concerning men's health?
Well, in general, men's health for African Americans, we have a more propensity of having hypertension and diabetes. A lot of that came from our heritage in Africa and the people that survived the Middle Passage, being able to hold on to salt and being able to hold on to sugar in order to make that Middle Passage. And, we've accepted that inheritance. And, a great deal of men's health just, has to be with everybody needs a primary care physician just to check in with and get blood pressures, blood sugars, and especially for men our age, over 50, we really, need a primary care physician to really help diagnose things before they become a big problem. I mean, you don't want to diagnose diabetes your first time in a diabetic coma. You would rather diagnose it when your blood sugar are pre-diabetic, so you can do some things to help curb that so you don't develop full diabetes.
Now, you mentioned the Middle Passage and some things that we bring over from Africa. One of the interesting things that I have discovered is that there's a yam extract that not men but women use, particularly for some female issues, and African American women. And in my studies, I have discovered that the yam was actually not just a cash crop, but it was revered very highly in West Africa because it was a cash crop. Is there any thought about the difference in diet and the difference in environment, the difference in exercise or lifestyle from Africa, and even 400 years later? Are we still, because of our physical makeup, different and dealing different with this environment here over here in America?
So, in Africa, if you read a great deal of history in Africa, of course, when we're brought up here through slavery and everything, a great deal of things that we eat are because of what we got as leftovers. So to cure pork, you have to salt it a great deal. And, if you ever hear of eating half the hog, a lot of people don't realize what that is. So when you butcher a hog, the highest part, which is the tenderloins or the pork chops, are the most valued parts. Some of the parts that we would get would be the hog jaws, the ears, the feet. Those things had to be heavily salted to first cure, but they also had to be heavily seasoned to taste decent. So, a great deal of the time they took the hams, the pork chops, and they gave us the pigtails, the feet, and everything else. And they initially didn't eat much of the bacon, but then they started eating the bacon. So, along with that, when we came over, we were mostly agrarian, even working in the fields as slaves, then as sharecroppers. Then when we were, left in the South, even after slavery, a great deal of what we did was raising crops. And that was meant to, you getting out there and, back in the 1800s, they plowed mules and things like that. And then they developed tractors. A great deal of us have gotten away from that necessary work and exercise. And great deal of us have desk jobs, and we don't get as much exercise at baseline as our ancestors did, which does affect diabetes and hypertension getting in our younger people earlier, and eating a great deal of processed foods. I grew up on a farm, and, we grew most of our own food. The only salted things we had were really the pork that we raised ourselves. But things that we eat now are a great deal of canned instead of fresh, and that has to be preserved, and a great deal of things that contain salt and sugar.
Yeah. Way back on Morehouse's campus, I think my sophomore year, I gave up pork. I don't think it had a whole bunch to do with dietary concerns, but hanging out with the conscious community, and nobody else was eating pork, so I stopped eating pork.
I did at the same time.
Yeah.
The conscious community, the Black Israelites on campus were talking about that, and they reference to the Bible, and you look at the Bible and it says it.
Yeah. There are things that are prohibitive.
Yes.
And even more than simply prohibited, there are things that are not healthy. There are things. Right. There are things. The excess sugar can lead to particular conditions. The excess salt can lead to particular conditions, and we in our community see these conditions emerge, as you said earlier, and certainly more often than in other communities. And so. There are specific things. You are an oncologist, and so there are particular things, not pancreatic cancer, prostate cancer, and colon cancer seem to be cancers that affect African-American males, or maybe just males, more so than others. Well, prostate would have to, right? So are there particular concerns that we should have, and are there ways that we can, we've mentioned before, eating or dietary adjustments? What are the things we can do to reduce the possibility or potential for these cancers that are affecting us greatly?
So there are really two major ways you develop colon cancer. Some is just heredity, familial polyposis, and also non-polyposis familial syndromes. Those things you really can't avoid. You can detect it early through colonoscopy. There are other things that, people develop with colon cancer because of their lifestyle, and the lifestyle issues that are affected with colon cancer are if you have less exercise, if you eat more red meat, and if you're overweight. So all those things affect the prevalence of colon cancer. So some things to reduce it: exercise, lose weight. It's not for vanity; it's really for health. And you lose weight, you gain it back. But if you continue just to gain weight, that's not good. So any little bit helps. Losing weight and exercise; those are the main things. And eating a more vegan diet does help also. But
Not
some of those, go ahead.
just vegetarian, but vegan.
Yes.
Okay.
Vegetarian, vegan, both are helpful,
So plant-based diet.
Yes.
And as you said, where we've come from, there's a more plant-based diet in Africa.
Definitely.
And so we have to think of our makeup. We have to think of where we have come from and things that historically we have ingested, so that we can then make the determination that there's some things here on this side of the Atlantic Ocean, and in this society and this culture that are not necessarily good for us, and those are things that we can make sure we're staying away from. What are some good steps to take to cut down on stress, and how can we ensure that we are doing the necessary things for self-care? We, as you said, we have desk jobs, but when it comes to jobs, our community does not have a lot of times the best jobs, and there are a lot of factors, social determinants of health, I guess is the tag word that's being used right now. But some of those social determinants of health are not just environmental, but they are the exercise that you're talking about. And how can we decrease stress so that we can live more healthy lives?
So, this is not just saying this because you're a pastor, but, having a good religious, spiritual base helps. Being a part of a church community, being a part of a group, any type of group helps you. So, you have bridge clubs, you have spades clubs. I also really recommend even people our age, get in sports clubs. There are people that play tennis, golf, making sure you're out active. I actually play rugby, which is a little rougher sport for someone who's our age, but a lot of exercise involved in that. Being a team member and having people to depend on you is very important.
So, what are some things that are going on with COVID right now? We have new variants that are emerging, and last time we had a chance to talk, we were at the verge of taking a vaccine. Many of us are taking a vaccine right now. Are there more direction that you can provide when it comes to the vaccine and when it comes to the particular variants that we're looking forward to? I heard that they shut down some provinces in Canada because of this strand that has come from India. And Dr. Fauci said we need to be very concerned about this new strand coming. And so how can you instruct us about that?
So there's the Delta variant that is really affecting India, and it's already here affecting us. The main two ways to avoid this variant is actually more contagious. And if you do get it, it actually causes more morbidity and hospitalization and sickness than the other variants that we've had. So social distancing, of course, but, people are tired of being cooped up. So, that may be out of the window for some, but at least wearing your mask and washing your hands and having good hygiene. The vaccine is protective of those variants. You may still get a COVID variant, but most people who are vaccinated, even if they get COVID, do not have to go to the hospital and do not have to have life support and things of that nature. So, it's not the vaccine is not totally preventative of testing positive for COVID, but it does help prevent some of those severe illnesses. So getting vaccinated is one of the major things to be protective. And of course, watching your environment.
So the new variant or the vaccine that we're taking now, the Moderna or the Pfizer, even Johnson & Johnson, all three of those are effective against this new Delta variant that are coming?
Yes.
That is coming? Yeah.
Yes.
Okay. Yeah. So what are some things we need to ensure we are doing. We talked about wearing masks. We talked about the social distancing. But of great concern right now is travel. We have a lot of members at First Baptist Church that are sending me text messages. They're sending notices letting me know that they are heading out of town and traveling on vacation. And so with our travel, we have the ability to contract more and to bring more back. And so are we out of the woods right now? Do we see light at the end of the tunnel? Should we go back to business as usual?
You know, that's hard. It's a hard question because, like I said, a lot of people with their mental health being cooped up, the number of homicides have gone up, the number of divorces have gone up, and people trying to get out for their mental well-being. But we're not out of the woods because we don't have the herd immunity yet. We need 70% of people vaccinated to get herd immunity, and we don't have that. So there are people, even young people now, that are contracting COVID because a great deal of the elderly and adults are vaccinated now. And so the more vulnerable populations is not vaccinated are the younger people. So, I don't think we're out of the woods. We do have a lower hospitalization of COVID over the last 3 months, and that is encouraging. But, just like the seasonal flu, you have ebbs and flows of this, and I don't think we're out of the woods. I think we still need to be vigilant. I've traveled very little. I've been on one plane trip in a whole year, and that's because I had to go on some business that I had to travel by plane. I have not felt comfortable vacationing as of such with my family or anything like that. And even when I do travel, I do try to be very vigilant and wear a mask and wash my hands, even though I'm very, very well vaccinated. And, I work at a healthcare center. And so, a lot of people that I see since they lifted the mask mandates, and nobody's really wearing a mask now. And probably the people that are less vigilant are the people who are not vaccinated.
Yeah. I had someone to say in a session that I have the vaccine, so I can't get COVID.
That's not true.
I'm protected. And I very quickly provided that correction, but it just showed me that there's the need for us to continue to talk and for us to continue to educate because of the nature of the spike protein or the nature of the nature of this vaccine. Can you tell us about specifically, once again, we talked about it 6 months ago, but if you could, for this audience today, sort of tell us how that vaccine works. Speaking of Moderna and Pfizer, right? And what's the difference between Moderna and Pfizer and Johnson & Johnson?
So the Johnson & Johnson is the only one different. The other two are made with spike protein. There's a different mechanism for the Johnson & Johnson. But it's the Moderna and the Pfizer are spike protein. So once it sees that spike protein, it really reacts to it and starts your immune system to protecting against it. So that means you could get the COVID in your body, and hopefully you mount enough immune system to stave it off where you don't get it. But there are people who are still positive and asymptomatic, and there are some people who are mildly symptomatic. Now, some of the caveats with how well the vaccine works depends on what your immune system was like when you're vaccinated. So I deal with cancer. So some of our cancer patients who are undergoing chemotherapy, they don't have a choice but to take the vaccine because they're going to be on chemo for months and months. And so they don't mount as great an immune response when they're vaccinated as others. People with chronic autoimmune diseases that are on steroids and everything else, they don't mount a greater immune response when they get the vaccine. So they're still more vulnerable. We're hopeful that a great deal of people with those conditions still vaccinated would not be hospitalized or die from the virus. So that's the major thing that we've seen. The vaccinated people have less chance of dying from the virus, but they could still get COVID.
Right, right. So you have the potential to still get COVID. The vaccine that you take creates it spikes or triggers the creation of antibodies. So
Yes.
so that when you get or come into contact with COVID-19, your body has already stored up enough antibodies because of the vaccine to fight it off.
Right.
Which does not mean you don't get it. It just means that you've taken a vaccine that helps you fight it off more. So you
Yes.
still have the ability to either be asymptomatic, you have the ability to spread to those that are not vaccinated, and even to those that are vaccinated. You can still carry and spread the COVID-19 virus.
You can, but it's less. They've documented that people that are vaccinated with healthy immune system have less of chance of spreading than a non-vaccinated person. So it's less, but it's not impossible.
Okay. And why is that? Because we're not coughing and sneezing as much?
Well, no, yeah, because you're less symptomatic. That is
Right.
true. And your body is keeping the number of copies of the virus down by attacking it with your own antibodies. So it's less virulent. You have a less amount of these copies of these virus to be expelled in your body. So the less number of copies, the less chance that you are able to give it to someone.
Okay. All right. So it's important to know, first of all, we've heard that we're not out of the woods when it comes to this virus, and that we need to remain diligent and extremely careful, prayerful, if you will, about these outcomes, because we're still in the midst of intra-corona, I call it. We're still in the midst of this season, I guess, that we're going through right now. You said earlier, a few months ago, that it's not forever. Can you encourage us in that way?
What, that COVID is not forever?
Yes, we need to hear it again.
Well, let me kind of couch that. We'll probably always have some form of COVID around, but these mask mandates and the big pandemic, we're probably not going to have, but we're probably going to be dealing with this virus forever. But the current restrictions that we had, not that we have, but current restrictions that we had are not going to be around. Right now when you're flying and cruising, there are more restrictions. And I think we're going to become more sophisticated in how we address it. And what I mean by sophisticated is when we start seeing spikes of COVID, and you can look at the CDC and they can tell you where the spikes are across the countries, just avoid those areas or shut down those areas like you did with COVID and nationally, and be smarter about that. And when we see the outbreaks, just be smart about not traveling in and out of those areas, and people being more vigilant in those areas. And I think that's the way that we're going to approach it in the future.
Okay. You mentioned earlier the effects of COVID and the fact that people want to get out right now. We are, as a society, suffering from lack of socialization. We're not spending time with one another, and I think there may be other effects of mental health that are the result of the time that we're living. How do you see is it evolution or devolution of mental health, and how is that concern increasing? How do we address it within our community?
Well, unfortunately, mental health in our community is a big concern, but is not addressed appropriately because, we in our society, in the Black society, if you're going to see a psychiatrist and you're crazy, and that's taboo. So we don't do as a community as good a job about accepting mental health or, people being on medications, and we just call them crazy and let's stay away from around those people. But, we're a very social society, and you take the socialization away from us, it can cause problems, especially elderly people. You see that even before COVID, people that are elderly that don't have any contact actually don't live as long. That's why they created the senior citizen centers and I mean, and nobody's really talked about, that, there are people dying of loneliness also, not just COVID. And, not seeing their grandkids, great grandkids, and, nobody's checking on grandma. And, grandma may have fallen and have issues. Grandma might not be eating because she has a different disorder. And so, in oncology, we saw a decrease of the number of patients that are inputted in our system, at Anderson around, because we didn't have as many people traveling and everything else. And we're going to pay for that in the near future as far as people coming with more advanced cancers and things like that, because they're just afraid to get out because of COVID. So those issues, we're not done with what's happening with post-COVID. Everybody's happy that the economy's getting better and everything else, but we're still going to have to deal with the both mental health issues and physical issues that are following COVID because of the isolation of a great deal of people.
Yeah, we have a project we're working on at First Baptist that deals with that isolation. It's an antisocial isolation project that we're working on with a major local hospital here in town to ensure that people, while they're separated during this time, are not isolated, particularly when they get out of the hospital. And we want to make sure that they're not shy to consult their physicians. And if we can get resources to them to help them to survive during this time, that's the attempt. We are very concerned about not just COVID, as you said, but there are people that will die from COVID, but there are also people that will die from not going to the hospital, from not seeking the physician's help, from conditions that remain dormant or metastasized because of lack of care and attention, because people are afraid to go to the doctor or because we're separated. And so you told me that your numbers are down for persons seeking oncology, for seeking help with cancers, which eat away at you.
Right.
And there are other pathologies that will increase, and the impact. People will die at a greater rate. People will get sick and remain sicker longer because they are either afraid or kept away from healthcare for some reason during this time. Are you seeing? You mentioned it, but is there a greater impact across other fields of medical discipline?
It is. So if you're looking for people who get their normal screening, like say if you need a screening colonoscopy or you need a minor surgery or a minor procedure, the protocols we have in place to protect against COVID are discouraging for coming to the doctor. So we still have in place, if you're coming as a new patient, you have to have a COVID test. If you're going to have a procedure, I mean, I had a dental procedure and I had to had a COVID test that same morning. I was talking to a colleague of mine that was going to have a screening colonoscopy, another physician, and they told him he needed a COVID test. He went and got a COVID test at our local hospital, and he was getting COVID. He was getting colonoscopy outside of our system, and they said, "Well, no, that COVID test is not good enough. We need our COVID test here for assurance that everybody's tested with the same test and reproducibility." Well, needless to say, as a busy physician, that meant another day that he would have to cancel patients. And so at that point, he decided he was not going to get his colonoscopy. And, this is a very smart guy. And, it doesn't matter. We still get disorders too. And so it was just frustrating for even a physician that knows how important it is. And so now his colonoscopy is delayed. And so what if he has a mass that is going to grow and he doesn't get a colonoscopy for another year or 2 years because he's frustrated with the system? Now, these are professional people that are frustrated with our system. Just think about the average person that are having to get a COVID test just to come to the doctor is very frustrating. So the systems, I'm not arguing with the systems, the systems are in place for a reason. But a lot of preventive care in general is being lost. If you're coming to a new patient in the system or have to have any surgery, any procedure, and you just, may have some frustrations or may not have the wherewithal to read that you need a COVID test before you get the procedure and things like that, it can get very, very frustrating. So we're going to be paying for this in the near future also.
So men of a certain age, we're of that certain age right now, and there's some tests that we need to get. At 40, you're supposed to get your prostate.
Yeah, your PSA. Now, we used to recommend a digital rectal exam. They've gone away from that because there was not very good reproducibility from that. So that's one hurdle that Black men are afraid of. They don't want to get
10 years later.
Yeah, they don't want to get a digital rectal exam. So, as a Black person, we have a high risk of prostate cancer, so we need to get a PSA at 40. The issue with that is that we think, well, the older we are with prostate cancer, if you're 80 and you have a high PSA, I probably wouldn't do much because it's a more indolent cancer. But if you and I can't get prostate cancer, we need to get on it pretty quickly because we still have more testosterone that can feed that cancer the younger you are. And so you really need to take action on that.
Yeah.
Colonoscopy, I have a history of colon polyps in my family. So I got my first screen colonoscopy at 40. And now over the last year, they've lowered the age instead of 50 to 40 for your first screening colonoscopy. Okay. Because we're seeing more and more people in their 40s develop colorectal cancer. And that's environment, the food that we're eating, our lifestyle, our obesity, things like that. So things are changing. So PSA and, getting a colonoscopy are very important things.
Yeah,
Another thing that, go ahead.
No, I was just going to say that when it comes to colonoscopy, I was not able to, because of COVID, they canceled my colonoscopy because a year ago, it's been a year and a half now, right?
Yeah.
But right when we were starting, nobody was going to the doctor, nobody was going to the hospital. And so I was able to get a packet in the mail, but I was insistent, right?
Right.
As opposed to just saying, hey, we can't do it now because of COVID. I asked the question. I said, okay, well, I had heard, is there a way for me to do this at home, an in-home test? And it is not the most, it's not the greatest process, right? It's not cool at all, right?
Right.
And particularly for you to be doing all this, but suffer it to be so, right?
Right.
That we go ahead and do what we need to do for our health. And so, I got the kit and returned the kit to you by way of UPS and got results back. That is, I understand, not as reliable as going in and taking the drink beforehand and doing all things for colonoscopy. It's not as effective as that, but they did say that, you're probably good for another 7 years from what we saw. They're able to give me 7 years before I have to go back and do a regular colonoscopy. I probably will not wait that long because we have to grab a hold of our health and we have to be self-determined when it comes to our health. But I think that's a part of the education that is necessary to let people know the questions to ask. And when it comes to your health, we know what the social determinants of health are. We know that there's racism. We know that mom and infant mortality is greater among African-American women. We know that when it comes to pain, that women aren't believed, that our community is not believed when it comes to the pain that we are facing. And so we're allowed to suffer. And so with all of those things, it is important for us to speak up for ourselves. And you don't depend on Dr. Google, but you investigate enough to know, and you research enough to know if somebody tells you that this is your condition and that they're looking at this, then take their word, but also understand that God has placed you on this earth with a brain and with resources that are available so that ignorance is a choice for us. We don't have to not know. We can know because there's information that's available for us. We can research to the best of our ability, and then we can ask educated questions. And all of that is a part of taking hold of our own personal health.
So let me tell you the difference between, I won't even say a difference in race, but a difference in an informed patient or patient caregiver and a difference in an uninformed. Uninformed patient comes in, tell them, what they have, what stage they have, how you want to treat it. And they just say, yes, doctor, and move on. And they don't ask them any questions. Those are the easier patients for us, but that's not the kind of patient I like, right? So the informed group, they have somebody in that group that is either well-read or in the medical profession, and they've already looked up, from the information they have, maybe what type of cancer they have, what stage it is, and, the possible treatments for that. And they've already looked up the available clinical trials that may be in the area, and they want to ask if they're eligible for that. So, it makes the physician be more accountable. What I mean by that is when you face that informed patient, you really have to tell them the percentages, why you're treating this, the need for the chemo or treatment that you're doing, the need for the surgery, or the other options. So that patient you have to spend appropriate time with and answer all their questions. And they leave the visit armed better with how to fight the cancer. And they also leave the visit knowing, whether this physician may or may not be for them. And instead of being frustrated, where a lot of our people are like, I just don't understand enough, whatever, but it's a dialogue. You understand what I'm saying? If you're a minister, if somebody is real read in the Bible and can really ask you questions, because the way you're taught the Bible and the way as lay people were reading it, it's totally different things. I mean, you're in school for this, and y'all take the Bible in sections, and you have you've done a whole course on a certain book in the Bible or chapter in the Bible. You've had to write papers on this. You've had to look up the Greek meaning of it. You've had to look up the Arabic meaning of it, and just because the way it's written in the King James Version may not be the true translation. And so when you can talk to someone that is more well-read than others, you can have a deeper discussion about the Bible and a deeper discussion about, how we how to be saved. And so it's the same thing with a physician. And a lot of times you have physicians that are not a part of your community that may be frustrated because, who do they think they are? But that's why they need more people of diverse backgrounds to be able to talk to people and break it down in language they can understand, and understand their norms. And different religions, different ethnicities have different ways of communicating effectively and different norms. And that's why we need diversity in medicine.
Yeah. We there are a number of health things that First Baptist is working on right now. We mentioned mental health before, because I'm very concerned that as we go through this season, that this isolation and even the grief that we're going through, I'm giving a sneak peek for a sermon that I'm looking at, dealing with Noah. Noah was a great leader and wound up drunk on the eve of Reconstruction.
Yes.
Because even though he was a great leader, he still had to deal with the stress and the strain of leading people.
Yes.
And he gets the boat docks, and everybody gets off the boat, and the world is about to be reconstructed. And we find him going through a bad situation because he acted differently than we think leaders should act. And so it's important for us to pay attention to that. We're also dealing with wraparound services for presenting conditions. We're dealing with AIDS and HIV. with specific projects at First Baptist Church North Indianapolis. In our Lafia Wellness Ministry, under the direction of Sister Marcella Armstrong, they continue to provide for us the education that we need. How can we ensure that we are getting these talking points, or that how can we ensure that we are educating? How can the faith community and how can our community in general get the word out better so that people can have better health outcomes?
Well, this is kind of cliche, but you don't have to go outside your own walls. There's a lot of stigma about sin and being able to come in church. I mean, especially dealing with our HIV ministry and things like that. And people feel that they're going to be judged, so they don't even want to come into the church. And, Jesus's ministry was not in the synagogue. It was in the streets. And I think we as leaders have to reach people where they are. And I think we need to recognize that some of these illnesses are illnesses and not just people having a stigma that they're just crazy. We as a Black community have to get out of that. And we have to start treating our mental illnesses appropriately instead of just, they're crazy, they're mentally incapacitated, just put them in a corner and, they're not a part of our society. Whereas you'll see people, with disabilities in certain communities, they're trying to do everything they can to find something to help that kid or young adult to integrate them in society. And, the autistic kids and everything else, there's a push to educate about the disorder and integrate them in society. In the good old days, what we did was we sent all the mentally ill to mental institutions and just kept them in the mental institutions. And then we found out they were being abused in these mental institutions. And, they've shut down a great many of these mental institutions. But I don't think we still have a good safety net for a great deal of people with mental illness, because it's hard for them to integrate in society. The paranoia, distrust, and a great deal of times we as church folks, and like I said, I'm not a minister, but I attend church regularly, think we're better than other people, and we're really not. Sin is sin.
All right. And then what is our role? What's our responsibility in the midst of all of these pathologies, in the midst of all of these conditions that people are facing? Ministry is meeting people's needs, right?
Right. Right.
Pure and simple. And,
right.
And people need guidance, direction, education, hope, love.
Yes.
Those are the things that we are supposed to provide. And so, look, we want to make sure we dig down just a little bit more, and that we don't miss anything that you want to share with us on today, because we wanted to talk about mental health. We talked a lot about COVID. We talked about mental health, but men's health, and we talked about various different cancers. What are some other things that specifically African American men need to take note of so that we can be better?
So, we have a great deal of still coronary artery disease in our society. High cholesterol, smoking causing coronary artery disease, causing cancer and everything. Instead of just having a doctor, I think every male and every person needs a dentist. There is a lot of bacteria in our mouth that can affect our overall health. And and there's been data that states that it maybe even increase coronary artery disease. So having a doctor and a dentist, and you might break a leg and have a problem, but people that have had a bad tooth, man, they won't come to work. They'll come to work with a broke leg, but it's hard when you got a tooth abscess or a cavity that's hurting or a tooth that's broken off. And we really need to start with good oral hygiene and dental health and our kids probably did a lot better, but I don't remember going to the dentist as a child for preventive health. And so a lot of us were just trying to make it. We weren't concerned about preventive things. And so, people our age, we need a dentist that we see, get our teeth cleaned and inspect our mouth. They may even catch an early oral cancer, with x-rays or something like that. So we really need to just pay attention to our bodies and, talk to our primary care physician or dentist. But if you don't have one, right, it's hard to get in. So, just get yourself established with somebody that you can share things with that can help you. I'm sure you as a minister go visit people who is, one of your sisters in the church, son that you've never seen, and they're sick and everything else. Is really hard to know what to pray for their soul and everything else if you've never really interacted with them. And it's really hard to get the things you need to help them spiritually if you know nothing about them. But, sister so-and-so is a good sister, brother so-and-so is a good brother, and you're going to still try to help as a minister. But, everything's about relationships.
All right. Let's say grandmama said your feet in your mouth will kill you.
Yes.
Right.
Yes.
and that's exactly what our doctor has told us on today. That there are a number of things that we need to watch out for. We've talked about cancers that are increased within our community and certainly among African American males. We talk about the cessation of smoking because it affects our cardiovascular system and creates hardened arteries and a myriad of other things, congestive heart failure. These are things that we can control. And so to live a healthy lifestyle, to go to the dentist, to, every 6 months is my checkup, and cleaning just to make sure things are in place. And to regularly go to the doctor. African American men are known for not necessarily wanting to go to the doctor. And when we look at life expectancy, if we look at white men, white women, black women, and black men are at the bottom. What is it? 60.
Yes.
Average age is 69 for an African American male. And for a Caucasian female, life expectancy is 82 or something like that.
Right.
And so you have 13 years of disparity that we can pinpoint. We can point to that and say that there are certainly environmental issues. There are stress issues. Poverty will kill you.
Yes.
Right? Lack of appropriate food. Lead in your water because you're living in a poor house, a neighborhood that has poor pipes or old pipes, and that's not just in urban areas. If your house was built in a particular time frame and they use those pipes, that can be in the suburbs somewhere. But all of these things are things that we need to make sure we are taking into consideration. And why is that age so low for mortality? It's because we're not going to the doctor and we're not preventative things, and we're not finding out enough about ourselves early. And then our classmate Corey Hebert always talks about crown, right? That we are excited about getting together with one another at the cookout, and not only are we eating swine, but we are ingesting things and we are inhaling things that lead to our life expectancy to decrease. So there's some contributory negligence when it comes to the health of African American men.
So that's a contributory negligence, but there's also it's hard to explain to white people that it is stressful to be a black male. And, this is not a racist statement, but when you're judged by when you come on this video camera of what you look like, and there are preconceived notions that you're not going to be as articulate, you're not going to be as smart just by showing up of who you are or being profiled. And white people don't necessarily believe that we're profiled, but I mean, you've lived in this skin and you're a very upstanding citizen, and I'm sure you've been stopped inappropriately, but you have the vernacular and you have the smarts to, talk your way out of it pretty quickly most of the time, because once they hear your dialect, your speech, they know you're somebody important, right?
And a valid registration.
In a valid registration, you have a valid license,
Right.
you have a valid insurance, and you can prove that this is your vehicle. And so they go from the hand on the gun to saying, Reverend, have a nice day, because they know there are going to be repercussions of doing something that is not appropriate to a man of your stature. But I worry about my sons who are 21 and 17, and they speak well, they have a good vernacular, but they're musculature and they're driving nice vehicles that you're not supposed to be driving. I mean, they're not driving Mercedes and Bentleys, but they're driving newer vehicles that you don't see young men in, and that I tell them to, when you get stopped, to call me, because you need somebody with some experience to get your way out of those situations. And so I'm not giving black men an excuse. I'm not saying that, but the stress, there's more smoking, there's more marijuana use, there's more drinking, because, a lot of times black men don't feel in control. And, not being in home with your kids, because your significant other or baby mother's on public housing, and if you get caught there, that she's going to lose her public housing, and things like that other people may or may not have to worry about are very stressful. And so I'm not giving them an excuse, but we have to find more effective ways to express ourselves and to help heal ourselves, and such as exercise, being a part of the community and doing something positive. So we have to do less of the bad habits and more of the positive things. And as you see, when you deal with a lot of people that are not African American, they're doing yoga. Other people outside the African American community were eating wheat bread back when we were growing up in the became a doctor. Not everybody that looks like you communicates well with you either. So I'm not advocating necessarily a physician that necessarily looks like you, but sometimes you can start there. But you have to have someone that communicates with you and takes you seriously. And, we really need to stop stigmatizing mental health in our community and start getting people more help.
And go to the doctor.
Yes.
That's what we've heard today. Make sure you're going to the doctor. Make sure you're going to the dentist. Make sure you are taking control of your health, that you educate yourself and find somebody to talk to, get second opinions. And once you determine that
less than what we should be at certain times, and we just need to all try to do better for our health.
With us before we transition out of this segment?
Well, I just encourage everybody. Look, I'm not trying to increase the amount of money we make. Most physicians make good money, but find yourself a primary care physician, someone that you can communicate with. I mean, just having someone that you can't share your problems with and that's going to take you seriously is not an effective primary care physician. So you might have to shop around and get one when you're healthy, not when you're sick. Find you a good dentist that is going to take care of you, communicate with you, take you seriously. Make sure you get your cleanings, fillings and everything else. Somebody that you can talk to. Now, that may be somebody that looks like you. That may be somebody that not looks like you. You have to shop around. And I tell my patients, say, hey, look, if we don't have a good, solid relationship and you don't think I have your best interests in heart, we need to help you find somebody else because I want you to live. That's why I became a doctor. Not everybody that looks like you communicates well with you either. So I'm not advocating necessarily a physician that necessarily looks like you, but sometimes you can start there. But you have to have someone that communicates with you and takes you seriously. And, we really need to stop stigmatizing mental health in our community and start getting people more help.
And go to the doctor.
Yes.
That's what we've heard today. Make sure you're going to the doctor. Make sure you're going to the dentist. Make sure you are taking control of your health, that you educate yourself and find somebody to talk to, get second opinions. And once you determine that yourself a little bit better, then you have the opportunity to have a better conversation with the health professional that you are going to. So once again, go to the doctor. And so Dr. Maurice Willis, you are my friend. Dear old Morehouse has brought us together. We are together, and I appreciate your sacrifice of time on today to make sure we as a community are better. We thank you for your brilliance and for your willingness to share with us on today. And we want to close this out simply by once again saying thank you for all that you do. Maurice Willis is my friend, and we look forward to the interaction we have. This is the Morehouse class of 1991, the incomparable, the awesome class of 1991, Morehouse College. And so we have ties that bind us together. And look, we're excited that we have an opportunity to continue to help people be better, to have dialogue and discussion about their health so that we can improve life chances and life possibilities for the members within our community. So thank you for being here on today, and thank you all for joining us.